Dr. Rost, Mr. Evans, thank you so much for joining me today. I want to start off with, how does the Brain Health Committee support the Brain Health Initiative?
So the American Academy of Neurology had a deep interest in brain health from the beginning, the 75-year history of the Academy. And the Brain Health Committee is a strategic collaborative committee that works with both internal committees and subcommittees of the Academy to meet the objectives of our initiative, but we also work as collaborators with our external partners in our initiative. And this would be really key, that we work not only with the internal committees and subcommittees to deliver, but working with everyone from the patient society groups, stakeholders, employers, regulators, policymakers. All of these will be key in how we deliver a true, impactful brain health initiative.
The AAN's Brain Health Initiative has a focus on preventative neurology with the vision of brain health for all by 2050. Can you talk more about this?
Absolutely. We're very excited about our brain health vision, which was included as part of the brain health platform published in our position statement in September 2023. And as you know, we envision the future by 2050 where brain health research is going to lead to breakthroughs in science and critical accumulation of knowledge that will help us guide patient care, public advocacy, and other efforts to optimize brain health across the lifespan. We're hoping for a future where evidence-based practice guidelines are available for every stage of life, and they're continuously updated so that we can continue to evolve with the science that's coming along.
And you have a newly released video to support this initiative. Let's take a look.
Brain health is at the center of a fulfilling and productive life. As neurologists and neuroscience professionals, the AAN's more than 40,000 members are uniquely positioned to lead the treatment of neurologic disease and the improvement of brain health for our communities. We are the leaders in neuroscience, patient care, public policy, and public education. That is why the AAN is empowering you to be the voice of brain health at every stage, from a person's earliest years into the rest of their life. The AAN expanded its mission to promote brain health for all and formed the AAN Brain Health Initiative. These pioneering steps continue our legacy in championing brain health. We as neurology professionals are the experts in brain health, and the AAN is here to lead the way by uniting all stakeholders. Let's work together to achieve optimal brain health for all.
What impact do you hope this video will have on that initiative?
I think it evokes inspiration, passion, and a couple things we want to do is, one is make sure that the video reflected the importance of brain health, the AAN's capacity to lead from a science-based approach, understanding and leading that through the entire House of Medicine, but specifically with neurologists and those that could be faced with a neurological condition, their care partners, or those living with a neurological condition, to realize we do have a path for success. And the other is to excite new people coming into neuroscience. So we want to have a draw and bring that interest into the community that is so important, that we have a workforce shortage that we also need to address. So as brain health trajectory increases, we need more people to help us deliver this action plan.
And I really hope that this video excites our members to just get engaged. There is place for everyone in this brain health initiative, whether you're a trainee, whether you're an experienced neurologist, whether you are an external stakeholder and work with a patient advocacy group. I think everyone can get engaged and affect outcomes of optimizing brain health along the lifespan.
Now, can you go through the 4 pillars of brain health that the initiative focuses on?
First is science. We're a science-led organization, and everything we do will be evidence-based, and there remains deficiencies in understanding all the components we know about the brain and its effect on the brain. It's highly understood, so we know that we need to advance the concept of research in brain health, which requires more funding, and so there'll be a strategic initiative just around that. The other is bringing the public to the table. So making sure that people know whether they have a neurological condition, a family member does, or that they just want to have optimal brain function through their entire life. We all have different interactions that may or may not impact our brain health, our brain wellness, and we want to provide that information science-based to the public, but also to help, so when a neurologist sees a patient, they're well informed to come into that office and have at least a basic understanding of the components that are going to help them get through their journey of a neurological condition better, more optimally, and hopefully reducing function. The other is advocacy. We need to work with policymakers, regulators, on how and what this looks like. So everything from the environment we live in, for how we work and function, how we play sports, and how we have access to healthcare, good food. All these things are factors, and there's data to support the disparities that exist in that. And we want to make sure that policymakers are aware of that.
Brain health is one of the targeted interest areas here at this year's annual meeting. Can you go through some of the offerings?
Brain health is center and front at every level of programming. Whether you're an education enthusiast, wellness enthusiast, whether you're into innovation or science, we have brain health offerings everywhere. So whatever you do, whatever your joy is at this meeting, please find brain health in every corner of the convention center and have a chat at the at the coffee shops and at the rest areas about brain health and how can we all get engaged.
Well, thank you so much for taking the time, Dr. Rost, Mr. Evans. It's a busy week, and we appreciate you stopping by.
Thank you.